Assalamualaikum. My group will present Chapter 3, the development of teenagers' issue in the classroom. This chapter will describe issues related to adolescent development and the way in which teacher can deal with this issue. First, language disorder. Language disorder is a communication disorder in which a person has persistent difficulty in learning and using various forms of language, like spoken, written, and sign language. Individual with language disorder have language abilities that are significantly below those expected for their age, which limit the ability to communicate or effectively participate in many social, academic, or professional environments. Symptoms of language disorder first appear in the early developmental period, when the children begin to learn and use language. Language learning relies on both expressive or receptive skill. Expressive ability refers to the production of verbal or gestural signal, while receptive ability refers to the processes of receiving and understanding language. Individuals with language disorder may have impairment in either their receptive or expressive ability or both. People with this condition have deficit in understanding and producing vocabulary, sentences structure, and discourse. Because these people with language disorder typically have a limited understanding of vocabulary and grammar, they also have a limited capacity for engage in conversation. There are two types of language defect. First, language delay, and second, language disorder. Language delay occurs when a children's language skills are acquired in a typical sequence but lag behind peer their own age. A language delay is a type of communication disorder. The children may have a language delay if they don't meet the language developmental milestone for their age. Their language abilities may be developing at a slower rate than most children. They may have a trouble expressing themselves or understanding others. Their delay may involve a combination of hearing, speech, and cognitive impairment. Next, a language disorder is characterized by atypical language acquisition significantly disrupting communication across settings. The example of language defect by language and communication component. There are 7 components. First, phonology. Second, semantic. Third, morphology. Fourth, syntax. Fifth, pragmatic. Sixth, separation. And lastly, listening skill.
Assalamualaikum warahmatullahi wabarakatuh and a very good evening. My name is Ifan Nazifa binti Zamzaidi. I will continue to the next presentations. The topic is about symptom of language impairment in psychological disorder. Okay, usually children and teenagers who has a psychological disorder will show the symptom of language impairment. This symptom is easily to detect by parents and teachers in school or house. Okay, the type of symptom is have 2 types. Firstly is for the lower symptoms, the symptom is the student is not listening while talking. Next is disobey while instruct to take actions, then tendency to talk a lot, and they like to interrupt, and sometimes they like to give an answer before hearing the whole questions. Okay, besides that, the symptoms show for the student who has an critical anxiety. They very nervous to speak in front of a large audience. Besides that, they shy in public, very sensitive to negative criticism and judgmental. They also refusing to obey the orders of other people, and they like to harass people, and they quickly get distracted. They also like to blaming others for their mistakes. Okay, now we go to the next topic, which is about effects of language defects. Okay, language skill is the most important things for students. If they have problem with that, it will affect their educations. The main effects of language defect is disrupt to personal and social relationship. This will make it difficult to understand others and difficult for others to understand them. Because of that, they also will be difficult to establish effective social interactions. Then they also difficult to achieve academic excellence. As a result, many of them hard to find a job and will affecting economic positions in the future. Okay, because of that, many of them involved in disciplinary cases, misconducts and misuse of illegal substances such as cigarettes, alcohol and drugs. This problem is not only give a bad effects to family and school, but it's also give a bad effect to society and country. So, to sum it up, this effect is not okay. I think that's all from me. Thank you for lending me your ears, and I will go to the next presenter. Thank you.
Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good morning. My name is Muhammad Aidil Azhar bin Ahmad Johari, and now I will presenting to you about the characteristic of problematic teens who are at risk of language impairment. Before that, my friend had told you about what is language impairment indeed. So now I will tell you about the characteristic, how we can recognize them, how we can recognize the student who have having this problem. Okay, first, the student have hard to understand and follow the instruction, and they can do any orders wisely, and they refuse how to start that. Okay, and then the student also behave rudely in social relationship. They can relate it with friends, like the other student, and also the student hard to use the language for daily requirement. The student also having a speaking trouble wisely. Next, number 3 is having disabled on how to arrange oral and written ideas. Then they also can't understand jokes and implicit comment. They also unable to understand others' emotion or predict other wishes. The student also giving the unsuitable reflection on question. For example, when the teacher asks them about what is the function of the car, but they will answer about what is the function of motorcycle. So then they also, in the class, they disable to remember the information that teacher has taught. For example, teacher asked them to finish the homework when back to home, but when they coming back to school, they does not finish the homework because they forget about the teacher has taught to them. In the class also, they disable to join learning and teaching activities and group working as well. They does not focus, they unfocus on teacher teaching, and the result, they fail on achieve lower level in academic. The student, this problem student, this language impairment student, also disable on using meaning and using words wisely. They unable to learn others. They also unable to learn others students' question. they also not good to have good relationship with friends. It means they cannot know how to start a relation related with others and so on, and then they are unable to finish the task uh, in fixed time. So we know that the characteristic of this problem student. So I will tell you about the language impairment assessment. The assessment, language disorder assessment or language impairment assessment. Uh, there are three assessment. First, scientific interview with the students, and second, evaluate with language test filtering tool, like clinical evaluation of language fundamental screening test, and three is filtering test with a standard test tool like comprehensive test of phonological processing and oral and written language skills. But in Malaysia, the assessment and diagnosis service for speech, language, and communication problems has offered in each hospital. And now I will tell you two examples for that. It is, for example, unit terapi pertuturan Pusat Perubatan Universiti Kebangsaan Malaysia. And second, unit terapi pertuturan Bahasa Hospital Tengku Ampuan Rahimah (HTA). The service that this hospital provide, the hospital offer is first, unit terapi pertuturan Pusat Perubatan Universiti Kebangsaan Malaysia (PPUKM). They identify person which facing slowness of speech and swallowing, and then they making suitable evaluation to get no level of language functional, speech and swallowing. Third, they do the implement therapy motive based on assessment result by personnel or group. And then they had a discussion session and feedback with parents after therapy session. And lastly, they making a therapy session with other professionals if needed, like counselor or physiologist. And the unit terapi pertuturan Bahasa Hospital Tengku Ampuan Rahimah, they serve identify communication, social and emotional needs of patient, and then they evaluate patient's need and make a comprehensive treatment plan. And then they provide consultation and education service to patient and their family members on speech and language. And lastly, unit terapi pertuturan Bahasa Hospital Tengku Ampuan Rahimah provide speech and language service to outpatient, inpatient and community, like filtering, evaluation, therapy, consultation and education. That also from me. I hope you will know about the characteristic and how to overcome this problem among students. That's all from me. Thank you and Assalamualaikum.
Hi, Assalamualaikum. My name is Nur Ain Zulaika binti Kamaruddin. I am going to proceed with the presentation. My part is about factors of language defect and ways to deal with it. This section will focus on the 4 categories of language impairment as described by Owens 2004. The first factors of language defect among students is mentally retarded. Their language features are as follows. First, less involved in conversation, or we call this type of problematic students as introvert. The second one is vocabulary is slowly developing. The next one is only able to build simple and short sentences. And the reference is similar to the development of preschool children. The last one is weak in terms of comprehension and language review. The way To deal with this type of students, students with learning disabilities can be helped by using visual and audio teaching aids. The use of such materials will increase their attention to learning and teaching activities. Teachers need to emphasize the differences and similarities of the words. For example, the word no hair should not be used as the word bald. Instead, the word no hair should be used instead. Methods of repetition of teaching materials, affinity, and memory technique can be used to enhance short-term memory. They also need to help to recall old tasks that were completed while trying to complete new tasks. The second factor of language defect is inability to learn the language. Their language features are as follows: not good at taking turns in speaking, don't know how to keep the conversation ongoing, difficult to answer questions, having trouble to understand the definition and languages. It is difficult to distinguish between letters or sounds of the same word. Difficult to understand negative and passive passages. And they also find it is hard to inconsistent in pronunciation, especially when speaking complex words. So we need to deal with them with a technique that can be used to help students with language learning problems is to reduce unwanted stimuli in the classroom. This will help them focus on teaching and learning materials. The use of visual and physical teaching aids can help students to understand spoken language. Teachers need to emphasize the teaching of the meaning of words. Students need to know that when the sound of a word changes, the meanings of the words will change as well. Conversation and discussions need to involve questions about what's new and spoken. So the third factors of language defect is specific language defects. Their language features are as follows. The first one is gate stop, less flexible in communicating information, provides inappropriate feedback for discussion topics. The story is less complete, slow vocabulary development, less able to make the description and misspelled words. So, teachers can do these things to address students with specific language defects. Teachers can naming letters and objects, recalling the verses that have been quoted, use the song as a tool to remember, acting out or adopting the picture, use sign language to remember and group words and objects. So the fourth factors of language defect is abandonment and abuse. Neglected or abused students exhibit the following language features. They are currently weak in terms of skills, avoid talking about feeling, chatting for a short period only, has a limited vocabulary in describing feelings, more often using simple and short sentences, pronunciation development is just like any other. And the last one is they has problems with the comprehension of spoken material and reading. So the way we have to deal with this type of students is to help this type of students who are victims of neglect and abuse. Teachers must first identify the cause and resolve cases of neglect and abuse themselves. In an effort to improve language skills for students such as these, teachers should encourage them to interact and communicate with peers. They also need to be trained to be sensitive to the stimulus, provide feedback, and participate in the discussion. Encouraging them to share their problems and express their feelings will also help them improve their vocabulary. That's all from me. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Emotional turmoil. Adolescents are a period of transition filled with change and challenge. The changes and challenges that occur in the teenager life can sometimes lead too many negative emotion. This is actually a very common thing. However, if the teen feeling and experiences for the very long time, or the social life of the teen is very much involved, disturbed by the negative feeling he experienced, we can say that the teenager is experiencing emotional turmoil. In this section, I will discuss two, but I will discuss just one, but one more, my friend. I continue. It's a type of emotional turmoil. Is depression. Depression is a disorder of one feeling a person feel prolonged sadness, fatigue, and lost energy, irritability, and loss of interest in daily activities. It lasts at least in 2 weeks. The disease can be treated by anyone regardless of age, gender, or race. Depression can last for months and even years. Symptoms of depression are many. Some of them is lost interest or enjoyment of hobbies and other activities that are usually fun. Quickly tired and powerless, feeling pessimistic and despairing, feeling guilty, self-esteem is useless, and more on. Depression teenager need more sympathy, more rest, more attention, and love from all sides. Sometimes the needs have even to meet the simple needs. There are times when their behavior make other angry, notice, and negative attitude toward depressed student should be avoided, and everyone should understand that they have not fully recovered from depression. Thank you.
Assalamualaikum warahmatullahi and a very good evening. My name is Muhammad Najib bin Shamsuddin. Now I will continue the presentation. I will present about anxiety. Anxiety is not all about negative. It also have positive side. For example, anxiety in education, student will study hard to achieve a good result. The main point I want to present is about the bad side in anxiety that will cause the brain to not perform well. Here I will share 5 characteristics of anxiety. Firstly, extreme and unrealistic fears of a thing, even situation and object. Second, feeling very anxious when being with strangers, and then afraid of being out in the open, and extreme fear of animals, altitude, darkness, and lightning. And last, difficult to concentrate and easily distracted. Every sickness have a treatment. Here are the treatment to fight anxiety. Firstly, family therapy. Secondly, exposure to techniques to control negative behaviors and mental processes. Then, the technique of relaxing the mind. And last, take medicine on expert advice. Next topic is behavioral disorders. Besides emotion disorder, teenagers also suffer behavioral disorders. In this section, I would like to focus on conduct disorder. Symptoms conduct disorder. First, often skips school and has a low level of oral skills and cannot master the skills of reading, writing and counting, and failing to carry out responsibilities, constantly fighting, damaging property, stealing and violating school rules. And then lack of sympathy, and last, lack of social skills and lack of skills to solve problems effectively. Here. Then I will share about treatment to fight the conduct disorder. First, treatment. Certain program combination are organized, and then good friends who has good manners can act as models, and then positive affirmation from parents and teachers, and last, using time out and judging. I think that's all from me. Thank you for watching and thank you for lending me your ears. We go to next presenter.
My name is Fatina Javentino Azumi. Today I want to present about discipline problems. So, what the discipline problem? So I will read from the slide. Discipline problem is a phenomenon that causes fear and consternation for most teachers. It takes many forms, including disruptive talking, inaudible responses, sleeping in class, tardiness, and poor attendance, failure to do homework, cheating in tests and exams, and willingness to speak in the target language. Next, what are the main causes of poor discipline? First, problems at home. Students who come from homes where the parents are divorcing are also under duress and can act out in class as a way to deal with their fear and frustration. Second, peers. Often students who bully and abuse at home, leading them to lash out at their classmates. In rare cases, students lash out and attack their classmates in class or even their teacher. Third, perception. Feelings of abandonment, lack of voice and depressions affect students who feel like you don't care about them. Some students could have issues adjusting to your teaching style. Okay, and the last one is disabilities. Children with learning disabilities can also sometimes be disruptive in class. These disabilities can be classified anywhere from attention deficit disorders, or we call ADD, to autism and dyslexia. In most cases, students with learning issues require a specialized education plan to teach to their needs. Many students with learning disabilities are on medications that helps them focus. So next, I will explain about stimulation. So what are the stimulation? Okay, stimulation refers to the deliberate act of hurting others physically or psychologically. We may not like to be physically aggressive towards others, but other people's actions sometimes force us to be aggressive. So the causes of stimulation is feeling frustrated, scared, or influenced by other people's aggressive behavior. Second, lack of love. And the last one is for teens, their physical change indirectly cause them to feel overwhelmed. Okay, next types of stimulation. We have 8 types of stimulation. First, directly. What is directly? Directly is physical or verbal assault on the victim. Example like punching the victim, speaking harshly in front of the victim. Second, indirect. Indirect is the action of the act is difficult to identify. Example like put a crunch in silence. 3. Instrumental. Be motivated to get something or get priority, such like cut the line, grab someone else's toys. And 4. Hostile. Intentionally want to hurt or hurt others, like threatening to kill, injure, or damage the relationship.
5 is proactive. Proactive is deliberate act of aggression against others as a way of achieving something or achieving a specific goal, like deliberately blocking other students' threats, deliberately hiding other students' books. Sit reactive. Reactive is to be an act of frustration or provocation from others, like revenge by hurting students who hide their books. Okay, 7. Physical. 7. Physical. Physical is take action that has the potential to physically harm others, like kick or repel others with the intent to bring it down. And the last one is the relationship. The action to negatively impact relationships with others, like stop communicating with others with the intention of hurting their heart. So the last one is the summary. So summary in this chapter, you have learned about some issues related to adolescent development, problems with language deficits, emotional disorders, and behavioral disorders commonly encountered in adolescents have been discussed. In particular, the types of language deficits, dysphasia, anxiety, dysphasive, and anxiety disorders have been the main focus of this chapter. In addition, ways to help adolescent students with language, emotional, and behavioral problems are also suggested. So that's all from me. Thank you.